Hello viewers, today I'll demonstrate a case of breast fibroadenoma microwave ablation, that is thermal ablation. So this is a completely non-surgical treatment to treat the fibroadenomas, that is benign breast lesions, in a non-surgical way, in a non-scar, no blood loss, no stitches. So this patient was suffering with the fibroadenomas in her breast, and recently she started experiencing pain on palpation. So she want to get rid of this breast fibroadenomas. So after giving the local anesthesia, we have slowly entered into the breast fibroadenoma. There you can see the needle is entering into the black colored lesion, round lesion in her breast. So once we are into the position, we'll connect this microwave antenna to the thermal heat and at the level of 30 watts, and we slowly try to heat the lesion and try to ablate the lesion. And see, one we have activated, and now you can see the white bubble started forming. That means the breast lesion is started getting ablated, heated. And once it is completely becomes white, we'll stop the heating and we'll remove the antenna. That means after complete becoming white, the lesion is completely destroyed. So this is how the microwave ablation or thermal ablation of the benign breast lesions is done. So this is the microwave machine. You can see the 30, and for timing is for the 50.